Hello everyone, and welcome again to the WVU Department of Emergency Medicine recording studios. This is Joe Minardi, and I'm here to go over a little bit about some of the life-saving things you can do with ultrasound-guided procedures. We're going to mostly talk about some fundamental things. We'll dive into detail on a handful of procedures, but really want to get you an introduction to a couple of things that can help you save a life when you see a sick patient in front of you in the hospital, in the ICU, or the emergency department. So we're going to go through a few fundamentals. Again, I'm going to emphasize a lot of the fundamentals because I think once you have a strong set of skills in identifying your anatomy and guiding a needle, you can then translate that to an abundance of procedures. So pretty much all medical procedures, what we're doing is taking a sharp object, usually a needle, but sometimes maybe it's a scalpel, and we're trying to get it towards a target, and then we've got things nearby that we want to avoid. So just examples of that in this internal jugular vein that is a lot of people's first foray into ultrasound guided vascular access. We have things like our target, which is the internal jugular vein, but then nearby we've got things like the thyroid gland and the carotid artery is a big thing we don't want to hit. The trachea is not far off. We've even heard of case reports of people lacerating the dura in very poor attempts at internal jugular vein access. So hopefully with some good fundamental skills and ultrasound guidance, we can avoid mistakes and problems like that. Our targets can be anything. We're going to talk a lot about some of the vascular access targets, but again, once you have a fundamental set of skills, you can translate those skills to kind of any target, which is vessels. Maybe you want to inject around a nerve to get a nice regional anesthesia, joint spaces, other fluid collections in the abdomen or the chest, abscesses. The possibilities really are endless. And I do want to point out, again, ultrasound, even though it does make things a lot easier, a lot safer, it still doesn't eliminate the risk completely. It makes the risk lower. It can make you more successful, but risks are still there, and you want to be careful and do everything possible to mitigate those risks. And we all know the risks of procedures generally are infection, bleeding, and injuries to nearby structures. And one other thing I want to point out and mention is that using ultrasound to guide a procedure that you already know how to do is not just adding ultrasound to a procedure you already know how to do. I want you to think about this. If this is new for you, I want you to think about an ultrasound guided procedure as basically a new procedure because you're not really using the same skills. Say you're used to doing landmark guided subclavian catheterizations. The skills you know for that don't all really translate to the ultrasound guided procedure because your hands move in different ways, your eyes are in different places, and so the coordination and the spatial relationships all seem kind of different, and those skills don't necessarily work together. Having the knowledge and the skill of the anatomy is certainly going to help, but your hand-eye coordination, your eyes and hands all move differently. So I want you to just think about these as new procedures and learning new procedures from what maybe you knew or did before. And there's really two basic ways that we do some of these procedures, either with a static approach or a dynamic approach. And we're going to talk about those in some detail. So static is where we may identify anatomy with ultrasound. Maybe we mark it out to find the right spot, delineate exactly where our target is, and then once we've marked out the anatomy, we often will put the ultrasound probe down, do some prep, and then hopefully successfully complete our procedure. And dynamic is the other one, and this is the one where your hand-eye coordination and skills really come into play, where we're actually guiding a needle in real time towards a target, and we're watching it under ultrasound guidance. So this first example here, we can see we've got what looks like maybe the ulnar nerve, and it's in a short axis orientation, and we're bringing our needle with an in-plane technique towards that nerve to try to surround it with local anesthetic. In this example, we're dynamically guiding the needle with an in-plane technique towards a long axis view of this vessel and trying to cannulate it directly. Here we've identified an abscess, and we just thought simple aspiration was going to be adequate, so we guided our needle into that abscess with real-time guidance. The last example, another vascular access procedure where we've got a short axis view of our target, and we're using an out-of-plane needle technique to guide that needle towards our target. So those are examples of dynamic ultrasound guidance, and that's what we're going to talk most about because this is what takes the most new hand-eye coordination and new procedural skills. To get into dynamic a little bit more, we're going to want to get some terminology kind of clear in our minds so we all are talking on the same page about the same things. So we want to be really clear about some of the terminology that we use, and one of the first things is recognizing how our needle is oriented in relation to the ultrasound beam itself. And there's really only two options for this. There may be some variations out there, but our main two options for needle orientation in relation to the ultrasound beam are in plane or out of plane. In plane is what we see in this first example here, where the needle passes through and stays within the ultrasound beam for the duration of our procedure along its whole course. And it should look something like this on our screen, where we can see the entire length of the needle as it's approaching towards our target. So that's called an in-plane needle technique. And when we talk about in-plane, we're talking about how the needle relates to the ultrasound beam. The other major technique is this out-of-plane technique, where the needle crosses through the ultrasound beam on its way towards the target, and all we can really see of that is a bright white dot on our screen with maybe some artifact behind it. One thing I want to point out with this is the needle looks the same whether we're viewing it at this point, or up here. So we'll talk about a few little things to do to help us actually figure out where the tip of the needle is and then guide it sequentially towards our target. The next big thing is our target and how the target itself relates to our ultrasound beam. What we're talking about here with short axis versus long axis is how our target relates to the ultrasound beam, not the needle. And we're going to spend a fair amount of time on vascular access, because that's one of the most important things where ultrasound can help you and be one of the most life-saving things you can do in gaining access. The way we usually pair vascular access is we use an out-of-plane needle technique with a short axis view of our target, and that's what that may look like on the screen. And here's kind of how the hands might look, although this technique I'm not crazy about because these hands are not stabilized against anything. The other common pairing with vascular access is where we get a long axis view of our target vessel, and then we utilize an in-plane needle technique to guide that needle along its whole course towards our target vessel. So those are some of the most common pairings for vascular access: in-plane needle, long axis target, or out-of-plane needle, short axis target. So that's short axis and long axis. There are just a few other things to help you make sure you're successful. As we know, all medical procedures are games of millimeters, so every little thing that we can do to help improve our success is going to make things easier and better for us. So just some basic ergonomic things. You want to make sure your ultrasound screen is lined up directly in front of you, and your patient or your target are also lined up directly in front of you. So you can easily be looking towards your target and then just barely shift your eyes to look at your ultrasound screen at the same time. You don't want some situation where you're looking over your shoulder and then doing a procedure on the other side of your body. That's going to hurt your success rate. Just like the speedometer on your dashboard is right in front of you in your line of sight, you want your ultrasound screen directly in front of you in your line of sight. And just like we use a tripod to stabilize us for detailed photography, we want to have everything nice and stabilized. I will mention stabilizing our limbs on rigid surfaces whenever possible. For some procedures, it's nice to pull up a chair where you can sit down and make yourself a little bit extra stable. These things might not seem to matter, but all of us, no matter how strong or how much endurance we have, the longer a procedure goes on, the more a little bit of a tremor we get, the more unsteady and the less fine motor control we have. So everything we can do to improve our motor control, stabilize us, is going to make us more successful. So take the extra 30 seconds to get all these steps right. And one of the last things I want to mention is you ideally want to try to set yourself up so that however you're driving the needle, it's going away from your body. You have better fine motor control by driving a needle away from you rather than going across from you. And you really never want to be driving the needle towards your body. Here's what that's going to look like. This is from a study published in the Journal of Ultrasound and Medicine that actually showed operators were more efficient, faster, and made fewer mistakes by driving the needle away from their body. Now, the transducer can be however you're holding it for the procedure, but the needle driving away from your body is the key point here. In this study, they compared that to holding the probe with this orientation. Probe isn't what's key, but driving the needle across your body is less effective, more mistakes, less motor control. So this is not what you want to do. So try to line up your ultrasound screen, align yourself in with regards to the patient so that you can be driving your needle away from your body, and you're going to be more successful. So for this next part here, we're going to bring in a couple of really brief fundamental ultrasound guidance technique videos that we put together for you. So take a look at these, and I hope that they are useful for you. I will also point out that we are not using our proper sterile technique